Hello everyone and welcome back to Jetset Jeremy, your slightly sarcastic, brutally honest guide to global travel, retirement planning, and the financial chaos nobody mentions until you are already sitting abroad wondering where your money went. I am Jeremy, originally from England, living in the United States for over 20 years and mostly loving American life. Today we are looking at a very American question, so please accept the usual preemptive apology from your friendly neighborhood Brit. What happens to your Social Security and Medicare if you retire abroad? This matters because I have spoken to plenty of American retirees who moved overseas and discovered the important rules after they had already left. Some were fine, some were emphatically not fine. The difference was usually simple. They understood what traveled with them and what stayed home. So today we are covering three things. First, what happens to Social Security abroad, including the countries where payments can be restricted and the form that can quietly stop your income. Second, what happens to Medicare once you leave the United States, which is where one wrong decision can follow you for life. And third, what smart retirees actually do about healthcare coverage overseas, because optimism is lovely, but it does not pay hospital bills. Right then, Social Security first, because there is good news here, and I like to start on a positive note before the clouds roll in. If you are a US citizen who has earned Social Security benefits, your monthly payments can follow you to the vast majority of countries. No reduction, no penalty, no dramatic government letter saying the money has gone on an unscheduled holiday. Countries like Portugal, Vietnam, Malaysia, Greece, Costa Rica, Japan, and dozens of others generally present no issue. The direct deposits keep landing, which is exactly what you want when your retirement plan involves sunshine, lower rent, and fewer conversations with American utility companies. There are exceptions. Cuba and North Korea are completely off the table, which I suspect was not central to your retirement plan anyway. There are also restrictions involving countries such as Belarus and certain Central Asian nations, unless you qualify for a specific exception. But for most places that appear on retirement shortlists, Social Security is largely portable. But once you have moved, unpacked, and started feeling dangerously organized, this is where people get caught out. The Social Security Administration sends beneficiaries abroad a questionnaire, usually every year or every 2 years. It confirms that you are still alive, still eligible, and still you. Sounds simple enough. The problem is that people miss it. It goes to an old US address. It gets mistaken for junk mail. It sits in forwarded post for months while you are busy learning which local supermarket sells decent tea bags. And if you do not return it, your Social Security payments can stop. There may be follow-up correspondence, but the outcome is the same. Miss the form, and your income can disappear. So keep your address current with Social Security and treat that questionnaire like the most important piece of paper you receive, because practically speaking it is. Two boring but important things before we move on. First, taxes. Moving abroad does not make your Social Security income invisible to the IRS. Depending on your total income and situation, those payments may still be taxable by the United States. Second, if you have a non-citizen spouse, the rules can get more complicated. A non-citizen may lose access to spousal or survivor benefits after 6 months outside the United States unless they qualify under a specific agreement. If that applies to your household, speak to a professional who knows the treaty details. Do not guess. Alright, Social Security is the easy part. Now let us get to Medicare, where things become proper. Sit down and have a cup of tea messy. Your Social Security will follow you almost anywhere. Your Medicare will walk you to the departure gate, wave cheerfully, and then go home. Original Medicare, meaning Part A and Part B, covers almost nothing outside the United States, apart from a few narrow exceptions. You can be fully enrolled, paying premiums every month, and once you are living abroad, that coverage becomes basically decorative. A lovely piece of paper that does very little when you actually need it overseas. So the instinct is obvious. If Medicare does not work abroad, cancel it and save the money. Understandable. Also potentially expensive. Track 1 is Part A, hospital coverage. Most people receive Part A for free because they paid into the system during their working lives, so keeping it costs nothing. But trying to drop premium-free Part A is not like cancelling a streaming subscription you forgot you had. For many monthly beneficiaries, avoiding premium-free Part A means withdrawing the benefit application that created the entitlement, and that can involve repayment of Social Security and hospital insurance benefits. In other words, do not casually touch this without professional advice. For most retirees, Part A is free, causes no active harm, and you leave it alone. Track 2 is Part B, doctor and outpatient coverage. This one requires a real decision because Part B has a monthly premium and does essentially nothing for you while you're living abroad. You might drop it to save money, maybe, but Part B has a late enrollment penalty. If you drop it and later want it back, you can pay an extra 10% on top of the standard premium for every full year you could have had it and did not. There are exceptions, especially if you qualify for a special enrollment period, but most retirees abroad should not assume they do. That penalty is usually attached to your premium for the rest of your life. You cannot negotiate it away. You cannot appeal it into oblivion. It is just there, every month, forever. So the Part B question is not really whether it helps you in your new country. It does not. The real question is whether you might return to the United States for medical care later. If you keep Part B active and fly home for a serious procedure, Medicare cares where you are, not where you live. Land on American soil and you are covered like any other Medicare beneficiary. That is why some expats keep paying for Part B from abroad. Not because it works where they live, but because it keeps the door open. It is not a fun monthly expense. It is not exciting. Nobody posts a sunset photo captioned, "Feeling blessed to pay my Part B premium." But for some people, it is the price of keeping a medical escape hatch back to the United States. This is much cleaner with original Medicare than with Medicare Advantage, because Advantage plans are usually built around provider networks and service areas. Now, some Medigap plans offer limited foreign travel emergency coverage, and some Medicare Advantage plans may offer travel or emergency benefits. But read the small print carefully. With certain Medigap plans, we are usually talking emergency situations only, often during the first 60 days of a trip, with deductibles, co-insurance, and lifetime limits. These products are designed for travelers and snowbirds, not people living full-time in another country. They cover an emergency on a trip. They do not cover your life abroad. So, Jeremy, what should I actually do about healthcare if I am making a permanent move abroad? Well, most sensible expats eventually land on a two-layer approach. Not glamorous, not especially Instagrammable, but much better than discovering the gap from a hospital waiting room. Layer 1 is local healthcare where you live. Countries like Vietnam, Portugal, Malaysia and others can offer strong healthcare at far lower costs than the United States. Depending on the country, your visa, residency status, and local waiting periods, you may use public healthcare, private coverage, or both. Layer 2 is international expat health insurance for broader coverage across borders and serious scenarios that Medicare cannot reach. The goal is day-to-day care where you actually live, plus a safety net if something bigger happens. Because retiring abroad should involve markets, beaches, food, and mild bureaucratic irritation, not medical bankruptcy with a better view. And this is where EKTA is worth comparing as part of your international coverage research. If you are spending extended time outside the United States, do not assume your domestic insurance will follow you. Check the policy wording, age limits, exclusions, deductibles, pre-existing condition rules, and whether the plan fits long-term residents rather than ordinary travel. Depending on the policy, EKTA can cover medical emergencies, hospitalization, and situations that standard domestic insurance may not cover once you leave American soil. It may also be worth checking if you are older and finding some providers less flexible. The link is in the description below. Have a proper look, compare the details, and make sure you understand what is covered before buying. Not all policies are the same, And this is one of those areas where reading the boring bits is tragically the grown-up thing to do. When Medicare is waving goodbye at the departure gate, you want something solid waiting on the other side. A few final pieces before we turn this into a checklist. The United States has bilateral Social Security agreements with a number of countries, sometimes called Totalization agreements. They help people who have worked in more than one country coordinate benefits and avoid certain double tax issues. The US has agreements with places including Japan, South Korea, Italy, Germany, France, Ireland, and others. If you have worked abroad and paid into another social security system, check this before finalizing your plans. Also, moving abroad does not change the basic claiming age question. Claiming Social Security at 62 instead of waiting until full retirement age, currently 67 for people born in 1960 or later, means a permanently reduced monthly payment. Delaying beyond full retirement age up to 70 can increase your benefit by roughly 8% per year. A lower cost country may make a smaller check feel larger, but the reduction is still permanent. Model it before deciding. Right, let's turn this into something usable. Before you leave, keep your Social Security address current and respond to every questionnaire immediately. Know whether your destination has payment restrictions. Do not casually cancel Part A. Make an informed decision about Part B based on whether you may return to the US for care and whether you can absorb the lifelong penalty if you drop it. Do not treat Medigap travel emergency coverage as a full healthcare plan abroad, and arrange proper local, expat, or international health coverage before you discover the gap the hard way. The retirees who handle this well are not always the richest or the ones with the fanciest advisors. They are the ones who understand the basic split before getting on the plane. Social Security is largely portable. Medicare is largely not. The gap between those two facts is where the expensive surprises live. If this helped, please hit the like button and subscribe to Jetset Jeremy. It really does help get this content in front of people before they make a very expensive assumption about what travels with them and what stays home. There is another video on screen now that connects nicely with this one. Go on, take a look. You have earned it after sitting through all that Medicare business. Right then, that is your lot for today. Sort the paperwork, understand what travels and what does not, and for goodness sake, do not casually cancel Part A. This has been Jetset Jeremy. Stay curious, stay covered, and look after yourselves properly. Cheers.